Blake is a fourth-year nurse student working at the hospital for his practicum experience. He recently learned the SBIRT approach and is meeting with his supervisor for feedback. His supervisor observed a recent patient encounter using live video feed and is ready to provide feedback. The supervisor will also use the ARCH model, which stands for Ask, Reinforce, Correct, and Help.
How are you? Thanks.
Doing fine, thanks. Well, we're here today to discuss how well you did using the SBIRT approach. What do you think? How did it go?
I thought it went well. She's obviously here in the hospital for an asthma attack, but she seemed open to talking about it.
Okay. What did you do well, particularly?
Well, I asked her the 3 pre-screening questions, and then I followed it up with an audit questionnaire when she scored positive for the alcohol question. I also made sure to give her some information that might be beneficial to her.
Yes, I noticed all of those things as well. And I really liked how you asked permission before asking questions. That really does help to engage a patient, and it shows respect. And you asked a lot of open-ended questions too, and that helps a person to just talk more freely, so you can get a lot of good information from that. What else did you do well?
Well, I made sure to ask about the frequency and the type of alcohol that she drinks. I also asked permission to share that information with her physician.
Yes, well done. It is so important to ask about the type and frequency of the alcohol use so that you get a clear picture of what she's really consuming. What would you do differently if you could do it all over again?
I think I would probably try to explain the audit a little bit better. I've never really had a patient ask me to explain it.
Sure, I can see that. What else?
I would probably try to respond a little better when a patient gets defensive.
Yeah, I agree with that. That was an opportunity where you could have just reflected her concern and then rolled with it a little bit. What would you say differently now? Let's say I'm the patient and I say to you, why are you asking me all these questions? I'm not an alcoholic.
Oh man, let me think. That's tough. Well, I can see that you're concerned about me asking all of these questions, but let me just say that these are routine questions that we ask all patients, and they help us better understand your health, right?
Very, very nice, very nice. You reflected my concerns and you normalized the questions. Can I suggest another change for the next time?
Sure.
Well, you gave some good information about the recommended drinking limits for women, and she did respond really well to that. You also used the decisional balance discussion really well. But there's one thing you could have gone a little step further in using the importance ruler to discuss how ready she is to cut back on her drinking. What do you think about that?
I think you're right. It did kind of end abruptly there at the end.
Yes, agreed. Let's actually practice the importance ruler. Again, I'll be the patient, okay? You've just told me about the recommended drinking limits, and I say, okay, I can see that. It makes sense to me.
Well, let me just ask one more question. On a scale of 0 to 10, with 10 being the most important and 0 being the least important, how important is it to you to change your use of alcohol?
5.
Okay. Now, why a 5? Why not something less, like a 2 or maybe a 3?
Well, because I know that I'm drinking too much, and I had a blackout once that was kind of scary.
So why a 5 and not a 9 or a 10?
Because I enjoy it too much. And in the blackout, I didn't have any problems from that. So.
What would have to happen for you to raise it from a 5 to something higher like a 7 or an 8?
Oh, gee. I guess if I had an accident, but I'd hate to wait for something like that to happen.
Okay. Well, is it okay if I share this information with your physician?
Sure. Well done, Blake. You did really good on that. One other thing. What do you think you could do to help remember to use that importance ruler the next time?
The pocket guide. I had it with me today, and I used it for the drinking limits, but I forgot to use it for the ruler.
Sure. Very good. Okay. Well, you are on your way to mastering the SBIRT.
The ARCH model is an effective approach in helping students learn the SBIRT model. By using ARCH, the supervisor reinforced what the student had done well while also providing constructive feedback for what can improve. Role-playing with students also helps to demonstrate effective SBIRT techniques like screening and brief interventions.